Hi guys, David Liss RVT here. I wanted to just do a really quick video on charting. I think that it's so important to talk about how numbers and values and things can be written on medical charts and why it's really, really important. So I'm going to walk through quickly just a really kind of basic anesthesia chart and a little bit about some other kind of random charting things. But I do want you to keep in the back of your mind that, you know, charts are legal documents and it's so important to have the most information that you can. So this is just a sample anesthesia chart. I know that some places do symbol-based charts, and that is fine too. But all of this information should be filled out really to the best of your ability. So up here we have, you know, induction, and we're going to put that, let's say, at 3:30. PM, and then our SIVO percentage, let's say we have the patient on, I don't know, 3%. Don't critique me on this stuff, this is all made up for right now. The O2, let's say it's at 2.5, excuse my writing there, liters per minute there, and the units are written in here, so you don't have to necessarily write all the numbers. The fluid rate, let's say that's 100 mils an hour, and the heart rate is 140, and the pulse ox is 98%. And the respiration rate, let's say, is 24 per minute. Mucous membranes, let's say those are pink, and 1 second CRT. Pulse quality is good or fair or adequate or whatever. ECG rhythm, let's say it's a normal sinus rhythm. There is some tachycardia. End tidal CO2, let's say it's 28. The blood pressure is, let's say, 114/92, making up all these numbers here, 77. And temperature is 101, anesthetic depth, appropriate, light, or deep, let's say appropriate, and pain assessment is a 1. So that's a lot of information to have on your patient. Now, 5 minutes later, so that would be at 3:35, you're going to fill in all of this information again, but it should not be cookie cutter. Most of this, 3% might stay the same, 2.5 liters of oxygen might stay the same, 100 mils per minute per hour of fluids might stay the same, but the heart rate should be different. It could be 138, it could be 142, or it might be 112. It may have actually changed. The pulse ox may be the same, but let's say it's actually changed slightly. Respiration rates may be slightly different. Mucous membrane, CRT, might be the same. Let's say the pulse quality has stayed okay. ECG is okay. But again, here we come to end tidal CO2. It could be slightly different. Blood pressure is going to probably be slightly different. Let's say 71. Temperature might be slightly different or might be the same. Adequate depth and a pain score of 1. So when I see charts that have 31, 31, 31, 31 written, I get very worried that somebody's not paying attention. So all of these rhythm values need to be changed and assessed every few minutes. The other information that I find very important is when we place IV catheters. We need to always include the gauge, the placement location, the date, and the initials of who placed it. So a properly placed IV catheter would be 24 gauge, right cephalic or right saphenous or whatnot. 529, and then the year and initials. All of that information is extremely important to put in. The other information is for blood pressures. When we chart those, we need to put the values down. So systolic, diastolic map. We also need to put down the heart rate to make sure it's matching, the cuff size, and where we put it. Right pelvic limb, thoracic limb, or rear leg, front leg, tail, whatever it might be. All of that information needs to be included, including our initials, so that somebody can reproduce these exact measurements. Lastly, make sure when you're charting that you open-endedly chart things like bandages and things like that. So patient incision appears normal, no redness or swelling noted. And make sure there's a time, a date, and initials.